My name's Julie Roy. I'm Head of Nursing for the Medicine Division here at Liverpool Heart and Chest Hospital, and I've very recently been asked to take on the role of Digital Lead Nurse for the Trust, which is great. It means I'm more involved in certain committees. I sit on the Digital Excellence Committee, which is chaired by the Chief Exec. So I suppose I am the voice or one of the voices of the nursing teams within that trust. It's an exciting time. We've got the new strategy, and so I suppose I see my role really as sort of being the champion of that for the nursing teams and being the interface between the Digital Excellence Committee and the staff that are on the ground. Probably very much from a ward level and nursing perspective, the handheld devices that have been piloted on some of the areas, and we're now we've got the order and we're waiting for those to be rolled out. And I think one of the biggest things for me is that Heart and Chest has got a really good electronic patient record, has had for a long time. It's very comprehensive, but actually I think what has happened for the nursing teams here is that the amount of documentation that they're having to do within that record means that they're spending a lot of time at a computer. And actually it's almost become, in some cases, a bit of a barrier between. So what I really wanted to see, or what we all wanted to see, was, nurses freed up from that and back at the patient's bedside, not tied to a PC at the nurse's station. Handheld devices, the wards are delighted. That's what that's going to do. It means they can do checks at the bedside, with the device, and actually the multidisciplinary team are going to be involved in that. We've got a great urgent referral system in the trust that the surrounding trusts refer patients in via. But there is this sort of, I think there was a phase one, which was, I've been here for 4 years, that was put in place just before I started. And the next phases were never rolled out. And I think there's been a bit of frustration amongst the teams of, when's that coming? Feels like all of a sudden now we've got that drive and we've got that momentum behind, and we can see changes coming, and which is great for the clinicians, because I think the digital team here, and what I really liked when I came here, was that they're really responsive. So they talk about the EPR, the electronic patient record, and they're actually they're really responsive to changes that staff want to make as well. So things that don't work well, there's a process where where staff can flag it or request a change. I think we've got challenges within the community teams almost daily, and I think the community teams can see, and it's with accessibility, with devices, and pretty, I suppose, to clinicians, it's pretty basic stuff that doesn't always feel right. I think one of the things that the new team, and certainly one of Kate's starting points, was sort of back to basics and getting some of those really obvious basic things, those frustrations sorted. And certainly the feedback from the teams is that's happening. We're rolling out a single sign-on now, and certainly the feedback from the community teams is it's a lot of work for them to do, but they're getting the right support now. Again, they've got access to the right people to help them and to support them, and I think it's a great time for the trust. I think we are digitally mature, but I think probably if you talk to people, they would say when the electronic patient record came in, there were a lot of promises, and then there's probably been a bit of a lull, and I think it feels like sort of the tide's turned a bit, the momentum's back, and there's a focus on digital and actually making staff and lives easier, but also putting staff back with the patient. And I think that's the big key for me. I think I suppose it's keep the support there that we're seeing at the moment. So if there's a significant investment, it needs a significant investment into it. We've sort of signed up to that, and that support, I think, is key. I think it's difficult sometimes when times are hard. We haven't got staffing levels sometimes that that as everywhere in the NHS, and I suppose there could be questions about why we're spending, there's a lot of money being spent on digital at the moment, but actually in terms of the improvements in patient safety, patient experience, staff experience, they're massive. And I think that for staff to see that support's there is a really positive thing.